Good afternoon. I'm Paul Karpecki. I practice in Lexington, Kentucky, and I want to, first of all, take this opportunity to talk about a nutritional company that I work with personally in my clinic and that I've known for a number of years. And I've done a lot of research in this area. I've really looked at every single company's products. I've analyzed what's worked in my clinic. I've looked especially at research and trying to see how that ties into individual type products. And after what I would say is extensive research, have come up with the ScienceBased Health as the company we utilize. So when they asked me to do a little introduction and welcome, as well as talk a little bit about my experience, I gladly accepted. So I want to tell you a little bit about that, and in particular a product called HydroEye. First, the company itself has been around for 15 years. It was started by eye doctors. I'm not one of the ones, but owned by eye doctors. They know us, and they understand the importance of nutrition. They have reasonably priced products, but more importantly, I think, is that they're based on science. They're a small company, so it makes them nimble. They have doctor flexible dispensing, referring. You can utilize it in your office. You can utilize the online system. They really make it easy for your patients and especially also for the doctors. So, it's top-notch from soup to nuts all the way through, well-referenced pharmaceutical-grade product. It's manufactured in the United States. They have experts on their boards. Great formulations, meaning that what they have for macular disease is very specific based on the science, and it's more than just fish oil for everything. They really go into it and say, okay, for science, we've seen the ARIDS data. We're going to incorporate what's important there. And we saw new data about smokers. We'll take this section and adjust it. Then there's new things that have come out on resveratrol, and we'll look at the science to decide to apply it. Then in, of course, dry eye, they've seen all the research around GLA, which is extensive. In fact, there's probably more research on gamma-linoleic acid, as in evening primrose oil or black currant seed oil, than there is even on fish oil. But of course, they also understand the importance of fish oil, so they combine all of these with vitamins, etc. And I think that's that science that creates the product that really is what I like so much about their approach. As I said, they're more than just fish oil. Although omega-3s are critically important and is a key component of their products, we all know that there's much more to it than that. Patients with virtually any of the major categories of eye disease could benefit from nutrition that goes even beyond that, or a nutritional supplement. There's optic nerve protection for glaucoma that's also been scientifically analyzed to determine what to put into that nutritional product. Retinopathy for diabetics in a product called Diavis. There's omega-3s, as we talked about, being real fundamental, but then whole body vitamins for the general benefit of all of our patients. Plus ARIDS standard type macular protection products that are also included in there. And then when they see new science and emerging research, they analyze it, and if it's very sound and well done, they incorporate it into their product. I do use it in my clinic, as I mentioned. I also take the supplements myself. What I really want to talk to you about specifically, though, out of all the supplement choices, is dry eye. This is an area that I am very passionate about, one I've taken a lot of research to. I've actually been working on it for 19 years, and I honestly can't say I've perfected it by any means. In fact, each year I realize there's so much more I have to know. But I have gotten to a point in my clinic where I now look forward to my Wednesday clinics. That's the day I dedicate to dry eye. The other days are cornea and everything else that walks in the office, as well as glaucoma, etc. But on my ocular surface disease days, I used to dread them because patients would come in and they wouldn't be as happy as I would hope they'd be. So then I'd try something else, and only in about the last year out of those 18 years have I finally started feeling like this is a lot of fun. These patients are excited, they're happy, they're telling friends. It's hard to admit it took that long for me to finally figure it out, but I'm grateful for it. A lot of that has to do with the nutrition, also has to do with new therapeutics, has to do with differentiating. Actually, asthenopium many times can cause dry eye symptoms. Conjunctival chalasis can look like dry eye. Once you start differentiating all these things, you can solve a lot of patients' problems. And so I tend to be a big proponent of nutrition, and it's particularly in dry eye, it is my passion. So as far as the science-based product in dry eye, it's called HydroEye. It is a guaranteed product to resolve dry eye symptoms. It's got fairly simple messaging. That is, it costs the patient about $1 a day and takes only about 60 days or less to start seeing results. And the key is that time frame. I really tell patients 60 days to see a result, and most importantly, they've really backed everything by science. In fact, one particular science I want to cover is a study that just recently came out, and this was on postmenopausal women, which is the largest single category of dry eye patients that we all see. It's also the #1 category in my clinic. And in this study, they had moderate to severe dry eye patients. A lot of people said, we're not sure if nutrition works when you get to this level. So it was nice to see a study come out. More impressive is the study came from perhaps two of the most respected researchers in the world. Steve Pflugfelder out of Baylor in Houston, and John Shepard out of Virginia Eye. So these are top-notch people. John Shepard is also associated with the Virginia Medical College, and of course Steve Pflugfelder with Baylor University. But really, so we know the respect we have for these individuals. We know how much research they've done. But finally, someone's taking on research into this important area of nutrition. It was a double-blind, placebo-controlled, 6-month study. So it was exactly what we wanted. It was presented this year at ARVO 2012. So people were real excited to see this. These women were randomized to receive either 4 soft gels of HydroEye, as we talked about, or a placebo. And they both looked the same. 38 participants completed the study. And the subjects were evaluated at 4 weeks, 12 weeks, and 24 weeks. So we had kind of early effect and then long-term effect. They looked at objective signs like OSDI and what patients would report as far as symptoms, and then specific things such as, things you can't mess up by investigator subjectivity, such as, sometimes staining can be graded differently, sometimes tear film breakup can be, but this was really objective, like impression cytology, where you take conjunctival cells and you analyze them. You can't miss that. It's going to be exactly right. Biomarkers for key proteins and inflammatory cytokines that you can measure objectively. And really what was impressive is HydroEye therapy significantly decreased the OSDI. So it wasn't just, we can measure all these improvements. Patients who took the Ocular Surface Disease Index questionnaire, so a symptomatology reference, had a statistical decrease, and it was highly statistical, p of 0.004 over the treatment time, while the OSDI score didn't change statistically in the placebo arm. At the end of 24 weeks, that held. There was still statistical significance between the two groups, with, of course, the HydroEye group having the impact and the placebo group showing no effect. Then if you go into impression cytology, where they stain the conjunctiva and they look for what's called HLA-DR, it's a test for evaluating true cytokine or inflammatory mediator expression in the epithelial cells of the conjunctiva. And it's really, I guess it's your best measure of inflammation that I'm aware of at this point. They look for things called integrin, which are proteins, and CD11C, that really they are the activators of immune cells. So they're kind of the precursor, but we know them to be the thing that kicks in the cascade, essentially. And it's in high concentrations on one particular type of cell called a dendritic cell. And this isn't necessarily related to HSV, where we have dendritic signs. These are true cells that are immune cells, and they're critical. People are all focusing on them right now, trying to look at the dendritic cells, because this is your biggest indicator for the presence of inflammation and the future cascade of inflammation. So they were obviously up on the science and targeting that specifically, and they found that it maintained the levels of HDLA-DR class II antigens on positive dendrite cells, meaning they did not increase. In the placebo group, they did. The positive cells significantly increased in that group, so it was able to maintain non-inflammatory states, or whatever state the patient was in terms of these cytokine markers, and again to statistics of 0.001. So the summary really showed that the HydroEye product significantly improved patient-reported dry eye symptoms in moderate to severe perimenopausal women, our most important category for the management of dry eye. And and I'm really glad to finally see some solid science that looks at this disease and looks at what's available. And I'm not surprised it ended up being a product called HydroEye. I've been seeing this in my clinic for years, and now I'm totally understanding why by the science that now is supporting it. So I hope that you take the time to visit the science-based health experts that are at your meeting and get signed up if this works for your clinic. It's easy to do. I've done it myself, and you won't regret it. If you have any questions you want to ask me specifically, colleague to colleague, you can email me, paul@karpecki.com, and put your phone number if you want to talk through it. I look forward to those. I'm always honored to receive those from colleagues, and certainly anything I could do to help my profession, I will take the time to do that. So have a wonderful meeting. Thanks for letting me participate via the internet, and I thank you.